You've most likely already come across mentions of Tadalafil. Perhaps you've seen it on a medicine label or heard someone call it a modern Viagra. However, few people realize that this drug's effects go far beyond erections. In reality, Tadalafil promises a lot, but it also carries a number of risks and pitfalls that doctors rarely discuss. Some claim it improves circulation, boosts male vitality, and restores a man's sense of confidence. Others talk about potentially dangerous side effects, including headaches, vision problems, low blood pressure, and even psychological dependence. But how dangerous is it really? Does Tadalafil help men restore potency in a natural and safe way? Or is it merely a temporary fix that hides the underlying problem behind a glossy pill, postponing real solutions and creating a closed loop of dependency? In this video, we'll examine Tadalafil in detail, frankly, without false modesty and without empty promises. You'll learn how this substance actually works in a male body and why many men report improvements in potency, stamina, and even emotional state. What the real, scientifically supported benefits are, especially for men over 60, and most importantly, what hidden dangers, not always obvious side effects, and risks can arise if it's used without proper medical supervision. For men over 40 who care about their intimate health, circulation, energy, and quality of life, this video may be a genuine eye-opener. Today, more than ever, it's important to dispel myths and truly understand how this medication affects your body, heart, and masculine vitality. How does Tadalafil work in the body? An erection is a chain reaction. It starts with a stimulus, physical or psychological, that activates nerves in the penis and leads to the release of nitric oxide, a natural gas that dilates blood vessels. This dilation makes it easier for blood to flow into the penis. At that point, Tadalafil comes into play as an inhibitor of the enzyme phosphodiesterase type 5, PDE5. Under normal circumstances, this enzyme counteracts the effect of nitric oxide, impairing circulation and preventing blood from remaining in the penis long enough to achieve a firm erection. Tadalafil inhibits this enzyme, enhancing and prolonging nitric oxide's action. As a result, blood vessels dilate more effectively, blood flow into the corpora cavernosa increases, and the erection becomes stronger and longer lasting. Notably, Tadalafil does not trigger an erection on its own. It only potentiates the body's natural response to sexual arousal. In the absence of desire, physical contact, or arousal, the drug has no effect. This mechanism prevents involuntary erections and makes the effect more predictable. It's also important to note that Tadalafil's action isn't confined strictly to the genital area. In some cases, it may improve peripheral circulation, lower blood pressure, and even help manage benign prostatic hyperplasia, a common issue in men over 60. In short, Tadalafil doesn't create desire, but clears the way for the body to function as it should when the mind and sexual stimulus are present. Dosages 5 milligrams and 20 milligrams. What's the difference? Tadalafil is commonly sold in two main doses, 5 milligrams and 20 milligrams. Understanding the difference is crucial for safe, effective, and sensible use, especially in older age. The 5 milligrams dose is intended for daily, continuous use. It acts as a light, steady support, keeping the body ready for sexual stimulation and, for many men over 60, provides more freedom and spontaneity without the need to plan intimacy in advance. It's like keeping the door ajar so the natural process can unfold whenever desire arises. The 20 milligrams dose is used as needed for specific occasions. It's taken some time before sexual activity, usually 30 minutes to 2 hours, and its effect can last up to 36 hours, offering a wider window, but also demanding more caution, since the higher dose increases the likelihood of side effects. People don't respond the same way. Some tolerate a low daily dose better, others prefer episodic use, and responses vary with medical history, blood pressure, and other medications. The choice between 5 and 20 milligrams should therefore be made under medical supervision, never on your own. Most common side effects, understand how they affect you. Tadalafil is effective, but like any active substance, it can cause side effects, which warrant attention, especially in men over 60 whose metabolism and cardiovascular and digestive systems are not as robust as in youth. The main ones are headaches, the most common, caused by the drug's vasodilatory action, which affects vessels throughout the body, including in the brain, altering intracranial vascular pressure and provoking pain that, in sensitive men, may be throbbing, facial flushing, redness, warmth, or burning due to dilation of facial vessels. Socially awkward but not dangerous. Nasal congestion. Mild stuffiness from dilation of the nasal mucosa vessels, sometimes disturbing sleep. Myalgia. Muscle aches, especially in the lower back and legs, likely from redistribution of blood flow affecting muscle metabolism and causing lactate buildup and small spasms. Dyspepsia. Indigestion, since tadalafil may relax the lower esophageal sphincter, leading to heartburn, bloating, or slow digestion, more common in those with gastritis or reflux. These effects don't mean the drug is unsuitable for everyone. They reflect individual reactions. Particularly after 60, people may respond quite differently, so close attention to any changes, however minor, matters. More serious, though less common, side effects require special attention, especially in older adults. While most side effects are mild and brief, rarer reactions can be dangerous, particularly with self-medication, combining other drugs, or undiagnosed conditions. The most important include priapism, an erection lasting more than 4 hours after arousal ends, painful and potentially tissue-damaging, requiring immediate medical care, sudden drops in blood pressure because of strong vasodilation, especially dangerous in men with unstable blood pressure or those taking nitrates, e.g., for angina, potentially causing dizziness, blurred vision, fainting, and serious cardiovascular issues. Hence the absolute prohibition on combining tadalafil with nitrates. Vision disturbances, blurred vision, temporary loss of acuity or color perception changes, linked to PDE enzymes present in the retina. Very rarely, tinnitus or sudden hearing loss. Skin reactions, rash, itching, facial/neck/chest swelling, and in severe cases generalized hives or angioedema, and occasional dizziness, confusion, or mild coordination issues, more likely in men with neurological histories or on CNS active drugs. Serious effects are rare but possible, and particularly concerning for men over 60 with age-related changes in cardiovascular, digestive, and nervous systems. Hence the strong advice against starting tadalafil on your own, even at low doses. Medical supervision isn't just a suggestion, it's essential. Absolute contraindications, when tadalafil can be genuinely dangerous. Despite its popularity and proven efficacy, tadalafil isn't for everyone. In certain situations, it can provoke serious side effects, hazardous interactions, or even fatal outcomes. The key absolute prohibitions include concurrent use with nitrate-containing drugs, e.g., nitroglycerin, isosorbide dinitrate/mononitrate, because the combined vasodilation can cause a precipitous blood pressure drop, syncope, cardiac arrest, or sudden death, hypersensitivity to tadalafil or its components due to risk of severe allergic reactions up to anaphylaxis, uncontrolled heart disease, severe heart failure, unstable angina, serious arrhythmias, recent myocardial infarction, within/90 days, or stroke, within/6 months, without explicit cardiologist clearance, severe hypotension or unstable blood pressure, e.g., frequent readings below 90/60ths mmHg, recurrent dizziness or fainting, severe liver or kidney disease, e.g., cirrhosis, end-stage renal disease, dialysis, as metabolism/elimination can be impaired, raising blood levels, anatomical penile deformities or predisposition to priapism, Peyronie's disease, cavernosal fibrosis, sickle cell disease, multiple myeloma, which increase the risk of prolonged, painful erections, and use of potent drugs that alter tadalafil metabolism, e.g., certain antifungals like ketoconazole, macrolide antibiotics like erythromycin, some anticonvulsants, which can raise tadalafil levels and side effect risk. Men over 60 with multiple such conditions must undergo thorough medical evaluation before any use. Self-medication is not merely unwise, it's dangerous. How to use Tadalafil safely. Know the right dose, frequency, and precautions to minimize risks. Even without major contraindications, Tadalafil is not a medication to take casually. Most negative outcomes, dependence concerns, and disappointments arise from improper use, absent medical oversight, or unrealistic expectations. Key points: start with the lowest dose, ideally 5 milligrams, especially after 60. For many, this daily dose supports sexual function without undue cardiovascular strain, offering a gentle, steady effect on circulation without needing immediate stimulation. For those who value spontaneity, consistency, and minimal side effects, this is often the safest path. If needed, 20 milligrams can be taken as a single dose 30 minutes to 2 hours before anticipated intercourse. But cautiously, the effect can last up to 36 hours, which is convenient but raises side effect odds. Never exceed recommended amounts during the active window. It won't help and may be dangerous. Never combine Tadalafil with excessive alcohol. While a small amount, a glass of wine or a modest serving of spirits, may be acceptable, heavy drinking can lower blood pressure, impair erections, and interfere with drug metabolism, provoking dizziness, confusion, malaise, or fainting, especially in men with cardiovascular disease. Remember, Tadalafil is not meant to boost athletic endurance. Using it for performance in heat or strenuous settings is risky for the heart. Respect dosing intervals and never double up. With 20 milligrams, avoid redosing within 48 hours to prevent accumulation and unpredictable reactions stressing the liver, kidneys, and heart. With 5 milligrams, keep a regular schedule. If you miss a day, don't make up by doubling the next dose. Keep up with regular medical checkups. Even if long-term use seems uneventful, risks can emerge over time. Shifts in blood pressure, hidden conditions, and interactions with new medications. So ensure your cardiologist and urologist are aware of your regimen, especially after 60. Tadalafil, despite its effectiveness at restoring potency, improving erections, and returning a measure of confidence, is not a cure-all. It helps manage symptoms, but does not remove root causes. An unhealthy lifestyle, poor diet, chronic stress, inactivity, and lack of adequate stimulation can all undermine intimate health even with the medication. Think of Tadalafil as support, not a panacea. Real improvement starts with lifestyle change. No pill can replace what the body truly needs to function well. In conclusion, men's intimate health is a cornerstone of self-esteem, vitality, and quality of life in later years. The effectiveness of Tadalafil isn't just about swallowing a tablet. It's also about clear information, conscious choices, medical oversight, and, above all, a way of life that supports healthy circulation, hormonal balance, and a close connection to your own body. In that context, Tadalafil can be a genuine ally, but only with responsible, mindful, purposeful use. Otherwise, it risks becoming a chemical crutch that merely masks the problem and delays real solutions. If you found this discussion helpful, share it with someone who might also benefit, a friend, a brother, or an acquaintance. Men often endure their difficulties in silence, and sometimes all they need is an open conversation, a clear explanation, and a first step toward positive change. Subscribe to the channel so you don't miss new material on men's health, vitality, and longevity. And share, because when a man understands his body, he gains the power to change his life for the better.